Welcome to the video on the U.S. healthcare system. This is, well, it's important because it talks about certain laws that are impacting the LEP patients that we serve, and it's also important to know them for us so that we can educate hospitals, clinics, just general staff. So first we want to ask, who provides healthcare? For us, who provides it? Well, the one that's the mainstream is the allopathic medicine. So they use drugs and surgery to treat disease. Right? This is the mainstream. So you have med students, doctors, residents, attending physicians, fellows. You could be an MD, and it could be a DO, a PA, an ARNP, a nurse practitioner, many others. But these are the mainstream in allopathic medicine, also known as Western medicine, right? What else do we have? Well, we have alternative medicine, not considered mainstream. So, a midwife, acupuncture, Chinese medicine, herbal healing, chiropractics. This is also part of the healthcare system that we need to know. Even though it's not mainstream, it's important to understand them. First, it's important to let's think about the schooling that doctors go through. It's often a misunderstanding when they say the resident's going to come in here, and the patient says, "No, I want a doctor. I don't want a resident." When in reality, those that finish medical school are doctors, and residency is just a training before they can specialize in a certain field, right? So if you look at page 169, you'll see an example of like medication, medical education. But for the most part, it's 4 years of undergrad at the very least, if not six, depending on how many majors you do and how long it takes you. But there are pre-med classes that you need to take along with getting your bachelor's degree, along with many other things, volunteering, leadership. If you want to do um, research, I mean, just anything to set yourself apart so you get accepted to medical school, along with an MCAT that is grueling. Um, Once you get to medical school, it's 4 years. After medical school, there's another 4 years to 6 years of residency, depending on what you do, as well as there is you can do internships to specialize even further. Uh, from beginning of undergrad until they're finished, it could take someone anywhere from, let's see, 12 to 16 years to finish all schooling. So it's quite the task, but it's important to understand the path a doctor takes because then you'll be able to help the patient understand by asking clarification to the doctor, to the resident, to explain their role as a resident that they are doctors so that the patient can be assured. When I lived in Mexico, they called clinics hospitals. Everything was a hospital, un hospital. There wasn't una clínica. It was all hospital. So what's the difference, right? Well, clinics, public or private, provide primary or specialty care for outpatients. So outpatients is the key here. They don't have any inpatients, so that you can't spend the night in a clinic. Hospitals, public or private, often provide primary care and specialty care. Now, primary care and specialty care is also can be provided at the clinics, but they also provide inpatient and emergency care. Well, now the clinics are actually starting to provide emergency care. As you notice, the Redwood Clinic has an emergency department. The um, Greenwood Center, then you also, those are clinics. The South Jordan Health Center has an emergency department, also urgent cares. And so it's the biggest distinction between hospitals and clinics is the fact that the hospitals can have inpatients, you can stay overnight, and the clinics are maybe same day appointments, surgeries that are same day surgeries. Okay. So, like we said, this can be difficult for patients to understand. If a patient walks into an urgent care that's an LEP patient from Mexico and they say, "Oh, you have chest pain and you have a weakness in your arm," yeah, this is more serious. You need to go to the emergency room or the emergency department. A patient's not going to understand that. They're just going to assume that they're refusing services. Same with the community clinic versus a Trauma One center. We already talked about this. But a community clinic could have basically everything that a Trauma One center has. However, if you're having a heart attack, you may have to have services that go beyond, such as you may need to go to the cath lab to have an angiogram done and then stay overnight for several days. So a clinic wouldn't cut it, right? So this is information that we need to know, we need to understand about the healthcare in the United States so that we can be able to be cultural brokers to our patients and help them to understand the culture of how the U.S. healthcare system is set up. Specialties, so here are common specialties that are pretty much in every country. Primary care, cardiology, dermatology, neurology, oncology. A patient would understand what these are for the most part. However, there are specialties that are not common, right? So bariatric services, diabetes education, men's health, occupational medicine, sleep medicine. The patient may not understand what these are, may have never heard of them, and thus may think it's not important to follow through with that referral. But if you see there's confusion, you can then be a culture broker and explain the culture of the U.S. healthcare system say that men's healthcare could be anywhere from infertility treatment to penile implants to um, any kind of urology issue, prostate, right? Paying for healthcare in the United States. I recently interpreted for a patient who said, who's going to pay for this? And the nurse thought it was a weird question. He's like, well, you are going to pay for this. That was a dumb question. However, this patient was from Venezuela, and while they don't have any services at all for healthcare, it is considered to be free healthcare. So this is, in the United States, we need to understand that there's no universal healthcare coverage, right? So if you have Medi-Cal, which is the Medicaid of California, it doesn't work here in Utah. Insurance, you need to understand the difference between premiums, deductibles, copays, right? These are all terms that the patient may not recognize and may not understand is why am I paying this here, but then they bill me later and then I have to pay every month to keep my insurance. It doesn't seem like I'm getting any benefit. I'm just paying and paying and paying. They need to understand how it works. And then government programs such as Medicaid, who qualifies, and how to apply for that. So the Affordable Care Act, this is an act that was passed in 2010 then went full effect in 2014, but the intention was to help people maintain their coverage, not to lose it. Make private insurance more accessible, bring down healthcare costs. Now when they say bring down healthcare costs, when you add young people into the mix that they have to pay for even though they're not using the services, the more people in the pool makes it less for those that use the services often. So elderly are paying less for healthcare, while as the youth, the young, are paying more because they're paying just to have it or else they get fined for it. So it also gives individuals and families more control over their health care. HIPAA. This is an important acronym to know. Health Insurance Portability and Accountability Act. This is confidentiality patient health information, so keeping patient health information confidential. We're going to go over HIPAA examples in class, but mainly it's just the entity that oversees and gives guidance as to what needs to be kept confidential, who can you share patient information with, who can you not, at what point are you breaking HIPAA rules. So we will go over this in class, but just understand that HIPAA is an entity that an act, a law that was passed that enforces healthcare providers to keep patients' information confidential. That we should not be able to identify anyone by you talking about them outside of the clinic, outside of the appointment, unless that person is part of the patient care team. Okay, there are healthcare laws and regulations. You may have noticed that in some hospitals or some clinics, interpreters aren't there. So why are interpreters used in some facilities and not in others? What is the reason? Why isn't everybody using interpreters? There's a law that requires interpreters. What is the law and who is it requiring interpreters for? That's a big question that many don't understand. And you can review this on page 174 because this is probably the most important law that you need to know as an interpreter. So Title VI of the Civil Rights Act of 1964. You will need to know this. Title VI of the Civil Rights Act of 1964. Let's read through this. No person in the United States shall, on the grounds of race, color, or national origin, be excluded from participation in, be denied the benefits of, or be subjected to discrimination under any program or activity receiving federal financial assistance. Okay, lot of really technical terms here. At the very end, it says receiving federal financial assistance. So let's break this down section by section to understand it better, okay? So on the grounds of national origin, what does that mean? So national origin, this can be being from a particular country, part of the world, associating with a certain culture or ethnic group, having a preferred language, right? These are all, you cannot be discriminated against because of national origin. So preferred language is part of your national origin. Cannot be denied the benefits of or be subjected to discrimination. What is discrimination? It is simply treating a person differently, okay? LEP patients or limited English proficient patients should not have to pay more or have less access to healthcare just because they speak another language. So interpreter needs to be provided free of charge to patients. Well, that's great, right? So that means everyone should be providing an interpreter. However, here's the caveat. Under any program or activity receiving federal financial assistance. So who receives federal financial assistance? How would you know if they receive it? Well, money from the federal government. This could be Medicaid, Medicare, federal grants, CHIP. All of these are federal programs, and if the hospital or clinic accepts these forms of federal government financial assistance, then they are required by law to provide an interpreter. So law may not apply to facilities who don't receive money from the federal government. So if they don't receive money from the federal government, if they don't accept Medicaid, Medicare, or federal grants, they are not required to have an interpreter present with the patient. Important to know. Okay, so what it comes down to is that ineffective methods of communication between providers and LEP patients would be a form of discrimination. So just because the doctor speaks a little bit of Spanish and can get through the appointment, that is a form of discrimination. Just because the MA can somewhat interpret for the doctor, that is a form of discrimination. Just because the patient says, well, this document's only in English, do you have anybody at home that can read English? That is a form of discrimination. And something that needs to be looked into by the facility, the clinic, the hospital. So what are effective methods of communication? Professional interpreters, right? Those that receive training and that are qualified to interpret. And this could be a staff interpreter, this could be a contract or agency interpreter, or it could be a bilingual employee, someone who has been trained to interpret. So somebody that's maybe gone through the Bridging the Gap course, but is just an employee and wants to stay an employee. Their clinic wants them to get certified so they can be the interpreter. So an MA that rooms a patient but then sometimes acts as an interpreter, if they have received training, then they are an effective method of communication. Also, bilingual employees who have passed a bilingual proficiency test by the clinic, issued by the clinic or hospital. But this allows them to speak to the patient on their own behalf, not to interpret. Interpreting is a skill much different from just being bilingual. So not family members. Family members are not an effective method of interpretation for many reasons, except in medical emergencies. If there's an emergency and there is no other means, there's no interpreter, iPad, or telephonic interpretation, then it is okay to use them. But it should always be a qualified interpreter. And we never use children as an interpreter. And so if somebody brings their child and says, oh, my daughter's going to interpret, and she's 16 years old, you can just let them know that actually it is against the law for children to interpret, and so the facility will not allow your daughter to interpret. I'm sorry I had to, she can't. I know that you would like her to, and I apologize. Okay? This is the end of the U.S. healthcare system video. If you have any questions, please write them down and we'll go over them in class.